Hey, Dr. Ratliff here. Got an update on COVID situation, what we're doing at the Plastic Surgery Center of Tulsa. First off, it's good news. The governor is letting us go back to work May 1st. We've been seeing patients all along, doing a lot of virtual stuff with FaceTime and Duo. I've seen some people live that we need to see, but basically we can go back to doing elective procedures May 1st. So we got that news 3 or 4 days ago, and Beth and Shauna got to work, and then we've been working to fill days and make things go from that point forward. To make up a little bit of the time and kind of help some of you guys that wanted to have surgery before the summer months came along, we're going to work Friday and Saturday of that first week. So we're working May 1st and May 2nd. There were 2 weeks of scheduled vacation time later in the month that we're going to fill with surgery. There's no vacation after having 4 or 5 weeks off. So at this point, we're working to get people on the schedule kind of in the order that they were, wherever possible. So that's the situation as far as surgery goes. The spa will be opening as well. Inject opens on May 1st. The qualifiers for both halves of the facility of the practice are going to be a little different. They're going to be nothing that you haven't already heard of from everybody else. We would ask that only you come for when you come for a spa appointment, unless you're coming for a procedure that you've got to have a sedation for, and then we would ask that you only bring one person with you. Don't bring the whole family, just bring one person. For surgery patients, we ask the same. If you're having surgery, please bring yourself and only one person. That person needs to be the person that's going to take care of you, because we're going to give them a lot of instructions and a lot of on-the-job training, so to speak, on how to take care of you. So it's better if it's the person that's going to be taking care of you after surgery, but only one. If we start getting crowded in the waiting room, we may actually ask people to go wait in the car, so that we can maintain our social distancing. The waiting room's just not that big. We're scheduling things a little further apart than normal, which means it's going to be a slower get back to work, a slower start, but I think that's the prudent thing to do. So that's what we're planning. I think, check my notes here, make sure I said everything. Oh yeah. The phones are open 9 to 3 every day. So if you have questions or need to make an appointment or follow up, they're being answered 9 to 3, and Shauna will answer you and make an appointment. If you have a surgery appointment to change, if you got surgery scheduled sometime in June or July, then Shauna will forward you over to Beth, and Beth is available to work on surgery scheduling as well. Oh yeah, the last thing, big news for us, as we've gotten more and more adept at doing FaceTime and Google Duo follow-ups, we've also been working on doing virtual consultations. So you don't actually have to come in the office, so nobody gets exposed to somebody else. We're going to try and set that up starting on May 1st. We've got some new patients scheduled. You'll be getting a call, and we're going to try and do this virtually. There will be a whole slew of things that you'll need to gather, get ready, be ready for those kind of appointments. Stuff that we would normally have in the office, but that you're going to need to create on your own. If you want to come in, we can still have you come in as a new patient. We're screening at the door. Everybody has PPE, and we're doing all that stuff. But a lot of times, if you're from far, far away, a virtual consultation may actually be easier for you. Or if you want to stay at home and do it virtually, we can do that as well. Surgery ultimately is a I gotta touch you kind of thing. So there's no virtual surgery, but we can at least get the ball rolling. We can get started on talking to you about what's good, what's bad. So those are the new things that are rolling out at PSC. We'll see how it plays out over the next couple of weeks. Thanks for bearing with us through this time. We're all kind of getting through this together. I think looking at the curves on the state health department website, I think Oklahoma has done a stupendous job at flattening the increase in cases. We're still not out of the woods. This bug is still going to be around, but in terms of overwhelming the system, we've managed to kind of hold it back. So I will see you sometime after May 1st. Thanks.